Hi, my name is Mason Doming, and I'm doing an informative presentation on ADHD. So, what is ADHD? ADHD stands for Attention Deficit Hyperactivity Disorder. It's a neurodevelopment disorder, and according to the CDC, these are some of the symptoms that come with that: difficulty remaining still, limited attention spans, forgetfulness, and anxiety being one of these symptoms also. So here are some statistics provided by the NSCH. About 5.4 million children in the United States currently have ADHD, which is about 8.4% of the children population between the ages of 2 and 17. And currently about 4.4% of adults have ADHD. So here's some diagnoses according to the NIH. There's a criteria by DSM-5. For children up to the ages of 16, there needs to be 6 prevalent symptoms in order for a psychiatrist to diagnose you with ADHD, and 5 symptoms for adults in order for them to diagnose you. And these symptoms have to be prevalent for at least 6 months in order for your diagnosis to be complete. So here's some types. There is predominantly inattentive presentation. There is predominantly hyperactivity impulsive presentation, and there's combined presentation. So predominantly inattentive presentation. I was diagnosed with ADHD when I was in middle school, so I was like 13 years old. I didn't understand it, but I had the inattentive aspect of it. I wasn't hyperactive. I just had difficulties, with organization, paying attention, following instructions, and I was always easily distracted. With the following instructions aspect of it, it's not like I'm aware of my instructions I've been given, therefore I don't want to do them. It would be more along the lines of I could have the instructions in my hand and I would want to follow them, and I'm doing it, and I don't understand how did I miss this one? No, I thought I was understanding of it. It's just, it's that memory, it doesn't grasp everything, and so which was a very difficult task as a child. So hyperactive impulsive presentation, this is what everyone thinks of when they think of ADHD. The kids are bouncing off the walls, they're talking, they're impulsive, they're impatient, and that's and that is the problem with their inattentiveness, is because they couldn't settle down enough to pay attention. And this a lot of kids do grow out of this. A lot of people get cured from it and live a normal life, in adulthood. I never understood it. All my peers had it. Who had ADHD had the hyper impulsive presentation, and so I understand why ADHD, because I was quiet, I was shy, I just could not pay attention in class. And the last presentation is combined presentation. It's just symptoms of both inattentiveness and hyperactivity. Usually when you're growing up, you go to adulthood, the hyperactivity aspect dissipates, but the inattentiveness remains throughout adulthood, who keep the diagnosis, or the diagnosis remains more like. So here's some treatments according to Chad. Behavioral treatments are usually for the hyperactive children. They start around like 6 years old as a recommendation from their psychiatrist. I personally never done it because there was no need. I wasn't a hyperactive kid. Medication would be the save all cure, quote unquote, for ADHD. So here's just a couple of the mainstream stimulants: Adderall and Vyvanse. I've taken both. I took Vyvanse from when I was in middle school, throughout high school. It was the extended release, so it kind of lasted all day, and I didn't like it. When I'm now in college, I take Adderall. It's instant. You have your peak in the morning, and then it dissipates throughout the day. It makes it a lot easier to manage your side effects. So the efficacy of stimulants improves attention span, impulsive behavior. It reduces hyperactivity, and it improves short-term memory. With the short-term memory, when I was before I even took medication, I can't remember things. But my mom also has short-term memory, but she was later diagnosed with ADHD in her adulthood. And it was actually after I was in graduate from high school that happened. So we just thought it was kind of a genetics thing. But when I took medication for the first time, and all of a sudden I can, remember assignments, remember vocabulary words, remember important things I need to remember for the next day. It improved my life, and it was a shock to me, and my ability to grow and being successful in high school was a big part of that. So here's some of the side effects of stimulants: insomnia, anorexia, decreased appetite, headaches, irritability, high blood pressure, and I can attest to all these except for about anorexia. But insomnia, as you're thinking about this, when I was like 13 years old, I would take it. I would understand why I couldn't sleep at night, be at 2 a.m., being restless, which caused a lot of anxiety and irritability in me already. Decreased appetite is one something I struggled with a lot. I mean, I wasn't anorexic, but in high school I played football. I was 6 foot, 210 pounds, and my doctor increased my medication. When he did, I started losing weight fast because my appetite was severely suppressed. I couldn't put anything down, and I went from 210 to 170 pounds within a year. My doctor, my parents got worried. My dad got to the point where he would just ask me what I want. He'll give me anything. He just give me a water burger, and I of course would accept because I wanted to try to eat. It wasn't like I was rejecting it, and I could only eat about a quarter of it. And it's hard to describe someone what a suppressed appetite feels like if they haven't experienced it already. It's like I want to eat, but my body doesn't. It's like forcing something that doesn't fit, like that, and it doesn't want to go down, and my body is like continually rejecting it as I'm trying to put it down my throat, which was not fun. Headaches, especially with Biovance with extended release. I would get severe headaches, which led to irritability. My head would be pounding, and by the end of the day, I would be irritated, and I wouldn't want to talk to anyone. It ruined a lot of friendships for me, and it got to the point, it got so bad where I just quit taking the medication altogether for about 7 years because it affected me that bad. High increased blood pressure, and I was talking to my doctor about this. With diet and exercise, you can prolong your intake of stimulants. You can almost take it for the rest of your life as long as you diet and exercise. And I was someone who takes Adderall, who runs, who diets. My resting heartbeat's about 70 beats per minute, which is really good even with someone without stimulants. But for people who don't take care of their bodies, maybe in their 20s, their resting heart rate would be like 100 beats per minute. As you keep going, it can increase up to like 120, and then you get into dangerous areas after that, and that can lead to heart problems, high blood pressure issues later on in life. So here's my conclusion. ADHD is a neurodevelopment disorder that affects about 5.4 million children a year. It is a mental illness, and it should be taken seriously because it does hinder a person's ability to succeed in life and grow and feel like a normal person. And medication is continuing to evolve, and the techniques that doctors use of prescribing medication has also evolved. Trying lower doses and talking with the patients. Like when my doctor said, we can increase 50% of your productivity, the medication has worked. And so that kind of, the psychology in your head, you think you don't need to be 100% peaking all the time. You just need a little bit of help to get you through the day and help you with remembering and being attentive with your assignments and work. Thank you.